Hello, this is Choma Liu again. Today I will be discussing about pregnancy, some bad habits you need to avoid when you're pregnant. Of course, we know what pregnancy is all about. Pregnancy is the period where a woman is nurturing a fetus from conception to birth, and it usually lasts for about 40 weeks. And it comes in trimesters. We have trimesters of the pregnancy: the first trimester, the second, and the third trimester. The first trimester usually lasts from first week to 12 weeks, the second from 13 to 26, while the third is from 27 to 40 weeks. Now, during the pregnancy, there are so many things that happen in the body of a woman. In fact, there are so many hormonal changes and everything, mood changes, symptoms that come alongside with pregnancy. And the major one we are aware or we know about very well is usually the nausea and the vomiting. Though these symptoms um, it's not compulsory that every woman experiences these symptoms, but most of the time, some women can experience all of them or some of them, and some women may not even experience any of these symptoms from the conception to the date of their delivery. Now, there are some bad habits that you need to actually avoid when you are pregnant so that you would not be causing harm to your fetus or to your unborn child. The first one here will have smoking and tobacco use. When you are pregnant, you are not supposed to be smoking or be using tobacco. Avoid smoking and using tobacco products. You need to ask for help. If you are finding it difficult to stop smoking during your pregnancy, you need to ask for help. Avoid secondhand smoke as well. What is secondhand smoke? The secondhand smoke is what we call passive smoking. Maybe you are around the place where they are smoking and you are inhaling the smoke. In fact, it is always very more dangerous when you are a passive smoker. So when you are pregnant, you avoid smoking, you yourself, and you also avoid passive smoking. Do not be seen around where cigarettes or tobacco is being smoked, so that you would not jeopardize the health of your fetus or your unborn child. Now, another thing is alcohol consumption. Some people will say, I've been having my children and I've been taking alcohol and no problem. You don't say that. You might successfully have a child, but most of the time, this alcohol can be so dangerous because it travels to your fetus and can be harmful to their development. Now, you need to avoid taking alcohol entirely. Avoid social situations where alcohol is present when you're pregnant if you want to have a healthy child. Now, another thing is drug use. Avoid using illegal drugs. Inform your healthcare provider about any prescription drug use. You don't just prescribe drug on yourself by yourself. Maybe when you were not pregnant, you feel weak or you feel headache and all that. Before you know it, you go to a pharmacy, you buy paracetamol, you buy these antibiotics or whatsoever. When you are pregnant, you need to be very careful of what you take into your body. Be careful of the drugs you take and avoid self prescription. If you are feeling anything that is outside of pregnancy symptoms, all you need to do is to go to the hospital, go to your healthcare provider, and they will tell you what to do and give you the accurate and the correct prescription that you need and that will not be harmful to your fetus. Now, another thing you need to avoid during your pregnancy period is caffeine use. Excessive caffeine can be very dangerous. Limit caffeine intake to less than 200 milligram per day. Some people, if you are finding it difficult to stop it altogether, you can actually limit it to the minimal level. You need to avoid energy drinks and caffeine rich foods. As a pregnant woman, you need to take more of vegetables, fruits. These are the things that can help you to have a very good immune system. It can even boost your immune and help your child to develop adequately and correctly. Now, you also need to avoid raw or uncooked food. Like some people, they say they like eating raw foods. Some even take raw meat. I don't know how they do that, but it is very dangerous for a pregnant woman to eat raw food. It is very wrong. And you should also avoid unpasteurized dairy products. Choose pasteurized products instead. Avoid unpasteurized milk, cheese, and dairy products. You need to avoid them. Any dairy product that is unpasteurized should be avoided by a pregnant woman. And you also need to avoid excessive weight gain. Sometimes with most pregnant women, when they come to the hospital, maybe for the first time antenatal appointment or that, they will check your weight, check your vital signs and other things. But when they see that your body weight is not in a good proportion, or maybe your body mass index is too high, that can affect your pregnancy, they will tell you to work on your food or work on yourself. There are some exercises that pregnant women are advised to engage in for the health of themselves and for their unborn children. And these are some of the things I will be bringing to your doorstep on a daily basis. So please stay tuned, because the next time we'll be meeting, I'll be talking about some of these exercises that pregnant women should engage in for better development of their unborn children and for their own health sake. Thank you for listening to me tonight. And the last one, sorry, let me not forget about this. The last thing you need to take serious when it comes to your pregnancy period is your antenatal visits and the drugs you're given. All this prenatal care and everything antenatal care you are giving in the hospital, please do not joke with it. Some pregnant women will say, of course, most of us when we are pregnant, because I can remember when I was pregnant too, I used to have issue with smells. There are some things that would smell so horrible to me. So that time I used to be angry when I perceive onion or any spice in the kitchen. And some people will say also the drugs they give to us, maybe the B complex, the multivites, and all those fesolates and all that, that it smells a lot. I can't even take it. I can't gulp it down into my stomach. Please do not, no matter how you feel, no matter how pregnancy makes you feel, please do not stop using your antenatal drugs, because they are very vital for the development of your child. Very vital, especially the folic acid. This is very important for your brain, for the brain of your child. If you want to have a healthy baby, you do not play with your antenatal drugs. Take them squarely. Be religious about it. Take them so that you would have a healthy child. This is where I'll be stopping today. Please follow me on my YouTube channel, and I'll be bringing more health tips to you every day. Bye bye and stay blessed.